Hello, my dear students. In this chapter, you are going to study analgesic, antipyretic, and anti-inflammatory drugs. These drugs have analgesic and antipyretic effects. And most drugs also have anti-inflammatory, anti-rheumatic effects. And most agents are orthotic drugs. So they are widely used in our daily life to relieve fever and pain, especially the fever and pain caused by inflammation. These drugs are a wide variety of drugs with various chemical structure. They are frequently caused by non-steroidal anti-inflammatory drugs because compared with another family of anti-inflammatory drugs, NSAIDs, they have no steroidal structure. Here, this means non-steroidal anti-inflammatory drugs because they have no steroidal structure compared with these groups. And these drugs, like hydrocortisone, this is a hormone released from adrenal glands. They also have very potent anti-inflammatory effects. Actually, so-called anti-inflammatory drugs broadly include non-steroidal anti-inflammatory drugs and steroidal anti-inflammatory drugs. Aspirin is the prototype of non-steroidal anti-inflammatory drug. So these compounds are referred to as aspirin-like drugs. Although these compounds have different chemical structure, actually they shared the same mechanism of their effects and some pharmacological effects. Now, look at the mechanism of anti-inflammatory drugs. In this family, the antipyretic and anti-inflammatory effects of non-steroidal anti-inflammatory drugs are primarily due to inhibition of prostaglandin synthesis. The molecular target of action is the cyclooxygenase enzyme. This cyclooxygenase abbreviation is COX, so that's why we often use COX to describe this enzyme. COX can catalyze the first two steps in the biosynthesis of the prostaglandins from the substrate arachidonic acid. Arachidonic acid is released from membrane phospholipids by phospholipase A2, and then COX catalyzes the oxidation of arachidonic acid to prostaglandin G2 and subsequently prostaglandin H2, and then PGH2 converts to the other prostaglandins in different tissue, like PGI2 in gastric mucosa, platelets, endothelium cells, PGE2 in gastric mucosa, kidney, peripheral nociceptor, and spinal cord neurons, TXA2 in platelets. So actually, prostaglandins generally act locally on the tissues in which they are synthesized. These prostaglandins are the metabolized substance from arachidonic acid. But this arachidonic acid is metabolized from cell membrane phospholipid by phospholipase A2. So actually, once this phospholipase A2 is inhibited by some drugs, these drugs also have anti-inflammatory effect, like steroidal anti-inflammatory drugs. Actually, these drugs, based on inhibition of phospholipase A2, they have more potent anti-inflammatory effects. And non-steroidal anti-inflammatory drugs exert effects that mainly depend on COX inhibition. Here, in this slide, you should pay attention. Actually, metabolism of arachidonic acid. This is the main way to produce prostaglandins. It has another way to produce leukotriene. Pay attention to this. Actually, this COX is the cellular target action of non-steroidal anti-inflammatory drugs. These COX include two isoforms, COX-1 and COX-2. This COX-1 is related to beneficial prostaglandins, and usually we consider COX-2 is related to harmful prostaglandins, because COX-1 is responsible for the physiologic production of prostaglandins, whereas COX-2 causes the elevated production of prostaglandins that occurs inside of chronic disease and inflammation. So we usually call this COX-1 is a constitutive enzyme. It regulates normal cellular process. Like in stomach and the intestine, it has a significance of cytoprotection. In the endothelial cells and platelets, prostaglandins production is related to platelets aggregation and vascular hemostasis. In kidney, prostaglandins by COX-1 is related to kidney blood flow. So they are related to some physiological functions at the local area. COX-2, sometimes it also caused by inducible COX. Because this usually COX-2 is just constitutively expressed in tissue such as brain, kidney, and bone. But usually, at the other sites, COX-2 expression is increased just during stages of chronic inflammation. So COX-2 is induced in response to inflammatory stimuli at other tissues. That's why it is caused by inducible type isoform, inducible COX-2. Prostaglandins involves inflammation, like vasodilation, edema in tissue, exciting the nociceptor to induce pain sensation, upregulation of the body temperature side point to cause fever. So here I think you can understand. Once some drug has no selectivity to these two isoforms of COX, maybe they have more pharmacological effects, even induce more adverse effects. If some drugs just selectively inhibit COX-2, so they have anti-inflammatory effects at the same time, they maybe have less adverse effects. Are you clear? And you know, like some drugs, because they have some anti-platelet effects, maybe they can decrease ability of blood to clot. Yeah, like aspirin has this effect. Okay, now I think you can understand the mechanism of non-steroidal anti-inflammatory drugs is based on inhibition of prostaglandin synthesis by inhibiting COX. Okay, this is the desired mechanism of their effect. What are the shared effects of them? Let's go on study. The shared pharmacological effects of non-steroidal anti-inflammatory drugs include four effects: analgesic effect, antipyretic, anti-inflammatory and anti-rheumatic, and anti-thrombotic actions. Why these drugs have analgesic effects? Actually, when the tissue has damage or inflammation, the algorithmic substance such as bradykinin, substance P, histamine, and plasma ions, this algorithmic substance can release from tissue damage or the local area of inflammation, act on the nerve ending to cause pain. During the inflammation, prostaglandins secretion, synthesis, and release also increased. And these prostaglandins can sensitize the nerve endings to the response of the bradykinin and this algorithmic substance, so make this pain sensation more serious. Means this is prostaglandins enhance the action of algorithmic substance. So non-steroidal anti-inflammatory drugs, because they can inhibit COX, so it inhibits the synthesis of prostaglandins. This sensitization of pain can be decreased by these drugs. As COX-2 is expressed during time of inflammation and the tissue injury, it is thought that inhibition of this enzyme is responsible for the analgesic activity of non-steroidal anti-inflammatory drugs. Actually, no single non-steroidal anti-inflammatory drug has demonstrated superior efficacy over another, and all agents are generally considered to have equivalent efficacy of analgesic effect. And these drugs are used mainly for the management of mild to moderate pain arising from musculoskeletal disorders. This is the first effect. Next one, antipyretic action. I think you know the body temperature usually stabilizes at a normal scope. It is because of the balance between the heat dissipation and the heat production. I think you know set point theory. When these two mechanisms are in balance, the body temperature is constant. And you know, this body temperature regulation center is at the hypothalamus. When the tissue has an infection with some pathogens, these pathogens and toxin or other substance stimulant can stimulate neutrophils and other cells to produce and release endogenous purines, such as some cytokines. These endogenous purines can enter cyanides, act on the local area of hypothalamus to synthesize more prostaglandins, so increase the set point of body temperature center. Then increase heat production, so body temperature increased to induce fever. So here, I think you can understand. During this process, it involves prostaglandins E2. Based on decreasing of the synthesis of prostaglandins, these drugs can decrease the heat production and increase the heat dissipation. So finally, fever is relieved by these drugs. Maybe you have experience of using paracetamol. After taking paracetamol, the body will increase the heat dissipation, like sweating, and decrease the heat production, so the fever can be relieved. These drugs lower body temperature in patients with fever by inhibition prostaglandins E2 synthesis and release. And these agents essentially reset the thermostat. This is antipyretic effects. Most agents of non-steroidal anti-inflammatory drugs, they also have anti-inflammatory effects. Inflammation is a normal protective response to tissue injury caused by physical trauma or infections with some microorganisms. Inflammation is the body's effort to inactivate or destroy invading organisms, remove irritants, and set the stage for tissue repair. When the tissue injury healing is complete, the inflammatory process usually reduces. However, inappropriate activation of the immune system can result in inflammatory response, leading to immune-mediated disease such as rheumatoid arthritis and rheumatism. Actually, the rheumatism or rheumatoid arthritis, it also involves inflammation. And during inflammation, the synthesis of prostaglandins elevates. It can induce vasodilation, vascular permeability increase, and induce tissue edema. So that's why when some patients have inflammation at the local area of inflammation, there is a classic inflammatory reaction. I think maybe you still remember this inflammatory reaction. It means heat, redness, swelling, pain, even loss of function. And usually during this inflammation, the expression of cellular adherent molecule, it also is increased. The drugs, non-steroidal anti-inflammatory drugs, by inhibiting COX, decrease the synthesis of prostaglandins. So the following response of the local area, it also can be decreased. Even decrease the expression of cellular adhesion molecules. So the inflammatory reactions, including heat, redness, swelling, pain, and loss of function, this also can be decreased by these drugs. Some agents, like aspirin, also has anti-thrombotic actions, because in the platelet and endothelial cells, they also have COX, but actually these two COX, they have different physiological function. COX-1 in platelet, they produce thrombosin. This substance promotes platelet aggregation and local vasoconstriction. It is related to hemostasis and thrombosis. And the COX-1 and COX-2 in endothelial cells, their function is here it produces prostacyclins, PGI2 prostacyclins. This function of this prostacyclin is opposite to thrombosis. It inhibits platelet aggregation and local vasodilation. So actually, the net effect on platelets and the blood vessels depends on the balance of these two prostaglandins. But actually, the sensitivity of these two cogs in different places, platelet or endothelial cells, they are different. COX-1, it is more sensitive than these cogs. So when we use aspirin at relatively low dose, it mainly inhibits these cogs. And on these cogs, that effect is very, very, very weak. So the result is inhibit platelet aggregation and inhibit the function of vasoconstriction. So it inhibits the thrombosis formation. But when we use this drug at relatively high dose, both these cogs can be inhibited. So its antiplatelet effects and anti-thrombotic effects will disappear. Could you understand? And this inhibition of these cogs is partially on the platelets, COX-1 inhibition. This effect is irreversible. So aspirin irreversibly inhibits COX-1. The antiplatelet effects persist for the life of the platelet. Chronic use of low dose of aspirin allows for continued inhibition as new platelets are generated. Because the lifespan of platelets are about 7 to 14 days. It is about 7 to 14 days. So here, I think you can understand. When someone have a long therapy with aspirin to inhibit the thrombosis formation, so if they need a surgery because of some disease, it is very important. It is necessary to stop using aspirin before surgery for advanced 7 days, at least 7 days. Make this function of the platelet recover the balance between these two prostaglandins. So that's why usually aspirin just used as relatively low dose. It always means 75 mg to 162 mg is enough. It usually is lower than this. When these drugs are used low dose, COX-1 mediated production of TXA2 in platelet, it is decreased. So platelet aggregation is more difficult. It has therapeutic effects. It is anti-thrombotic effects. But when this drug used at relatively large dose, blood vessels endothelium cells, COX-2, it also can be inhibited. Prostaglandins I2 production, it also decreases. This function of PGI2 and TXA2, they are opposite. So the therapeutic effects will be decreased by the large dose of aspirin. Are you clear? That's why anti-thrombotic effect of aspirin just used in low dose. So These shared therapeutic effects of nonsteroidal anti-inflammatory drugs are based on inhibition of the prostaglandin synthesis by inhibiting COX. Okay, that's for this section. What are the classification of nonsteroidal anti-inflammatory drugs? And what are the effects and clinical uses of aspirin? Welcome back. Let's go on study. The drug classification. Non-steroidal anti-inflammatory drugs can be broadly divided into two groups: non-selective COX inhibitors and selective COX-2 inhibitors. Non-selective COX inhibitors include aspirin, acetaminophen, indomethacin, ibuprofen, and phenylbutazone. In these agents, aspirin is also caused by sodium salicylate. It is the representative drug in this family. And compared with the other agents, it is the most important. I think you can understand. We will study aspirin in detail. Because COX-2, it is inducible COX. It usually elevated activity during process of inflammation. So selective COX-2 inhibitors compared with non-selective inhibitors, they has relatively less adverse reactions. So this group include rofecoxib, celecoxib. Now first study aspirin. The pharmacological effects, clinical uses, and adverse effects of aspirin are more important. You should know well this content. Let's study in detail. The first effect is analgesic effects, in Chinese, 镇痛. Aspirin, it is the most effective in reducing pain of mild to moderate intensity pain, such as headache, toothache, dysmenorrhea, arthralgia, even neuralgia. This mild to moderate intensity pain, we can use aspirin to treat, but it is not effective for severe visceral pain, myocardial infarction, renal or biliary colic. It is not effective because this pain doesn't involve inflammation. Like myocardial infarction, it is caused by ischemic reaction. Under renal biliary colic, it is related to smooth muscle spasm and directly stimulate the nerve ending. And aspirin acts primarily through its effects on inflammation, but probably also inhibits pain stimuli at the subcortical site. The characteristics of analgesia of aspirin include: it is one moderate analgesic. In the treatment of inflammatory pain, its effectiveness is well enough, but for severe or colic pain, it is useless. And compared with analgesics like morphine or pacillin, aspirin has no addiction, no respiratory depression, and it also has no euphoria. Its functional site is primarily in peripheral tissue. And the mechanism depends on inhibition of COX to decrease the prostaglandin synthesis. The second effect is antipyretic effect. It also is mediated by COX-2 inhibition in seeing eyes. Fall in temperature is related to increased heat dissipation caused by vasodilation of superficial blood vessels and may be accompanied by profuse sweating. So after taking aspirin or other agents in this family, it often induces sweating and then relieve fever. It can be used to treat fever caused by aneurysm. The characteristic of antipyretic effects include it just lower the elevated body temperature. And if the fever caused by aneurysm, it is effective. But aspirin has no effect on normal body temperature. Its antipyretic effects is independent of environmental temperature. This is different from chlorpromazine. Do you still remember this drug? It is one antipsychotic drug, usually used to treat type 1 schizophrenia, and act on the seeing eyes. It also can alter body temperature according to the environment temperature. With the physical cooling, chlorpromazine can decrease the body temperature even lower than the normal scope, like close to 30 Celsius degree. If the environment temperature is higher than the body temperature, chlorpromazine also can increase the body temperature, even higher than the normal state. But aspirin, it just reduced the elevated body temperature to the normal state. When the body temperature recovered to the normal state, aspirin cannot further alter the body temperature. So they are different. It also has no effect on fever caused by prostaglandins intravenous injection. Its antipyretic effects, it depends on the synthesis of prostaglandins inhibition, by inhibiting COX. So once this fever caused by prostaglandins intravenous injection, it is invalid. And the fever usually caused by some microorganism infection. So it decreased the elevated body temperature. It is just symptomatic treatment. So it cannot relieve the reason for the fever. So if there's a fever caused by infection with bacteria, antibiotic drugs also are more important. Do you understand? If it is caused by virus infection, antiviral drugs, it also is important. When we use aspirin in high dose, its anti-inflammatory and anti-rheumatic effects are more obvious. Using aspirin in high dosage is responsible for the treatment of various kinds of inflammation, like acute rheumatic fever, rheumatoid, and other types of arthritis. I mentioned this rheumatoid arthritis, it is also involves inflammation, and this inflammation also is mediated by autoimmune function. When we use aspirin in high dose, it can also inhibit this inflammation. It has been advocated as a diagnostic test when acute rheumatic fever is suspected. So actually, large dose of aspirin, it also has a significance in diagnosis of rheumatic fever. If this acute rheumatic fever is suspected, just use aspirin in high dose. If the fever is relieved by large dose of aspirin within 1 to 2 days, we can diagnose this is acute rheumatic fever. So it has this diagnostic significance. But it usually requires a higher dose than antipyretic effects and analgesic effects. Effects on platelets. Aspirin in low dose, it can inhibit platelet aggregation and produce a slightly prolonged bleeding time by irreversible inhibition of platelet COX. And low dose of aspirin can inhibit the production of TXA2 in platelets without markedly interfering with prostaglandins I2 production in endothelial cells, because COX-1 in platelet, it is more sensitive than that of COX in the endothelial cells. So when use aspirin in low dose, aspirin just inhibits COX-1 in platelet, so reduce the production of TXA2 without effect on the COX in endothelial cells. So the function of TXA2, it is decreased by aspirin. It can induce antiplatelet and inhibit platelet aggregation, has this effect. So because of this high selectivity to COX-1 in platelet, we just use aspirin at 50 to 100 mg in a day to prevent thrombosis. So by using aspirin in low dose, about 100 mg in a day, decrease the intensity of it can decrease the incidence of transient ischemic attacks, unstable angina, coronary artery thrombosis with myocardial infarction, and thrombosis after coronary artery bypass grafting. So after using this aspirin, especially chronic use of aspirin at low dose, it will induce the continuous inhibition of TXA2. So inhibit the thrombosis. But during bleeding, we also require this function of this TXA2. When some patients requires a surgery, and at the same time, they use aspirin in low dose to prevent this disease attack. Try to stop 1 week prior to surgery to avoid bleeding complication. During surgery, it must induce bleeding. And during this process, we usually require hemostasis, to promote the platelet aggregation and local vasoconstriction. to prevent bleeding complication. So it is very important. Stop 1 week prior to surgery. Okay, there is a summary for aspirin. The effects of aspirin include 4 points: analgesic, antipyretic, anti-inflammatory, and anti-rheumatic effects, and anti-thrombotic actions. Based on these therapeutic effects, aspirin is very useful. It can be used to treat various pains, such as headache, toothache. The required dose is usually in a day 2 to 3 grams. It also commonly used to relieve fever caused by any reason. It is effective. But don't forget, it is just a symptomatic treatment. For the acute rheumatic fever, it can be used for differential diagnosis. Once after using aspirin in a large dose, the fever disappears within 1 to 2 days. It can be diagnosed. Rheumatic arthritis. It can work as the first choice in the treatment of rheumatic arthritis. Usually, this condition requires a large dose, 3 to 5 grams in a day. Don't exceed 5 grams in a day. To prevent thrombosis formation, we just use aspirin in low dose. In a day, 1 mg, maybe it is enough. But once some individual diagnosed by myocardial infarction, acute myocardial infarction, the first time of administration, usually it is 300 a gram, 300 a gram, mg, 300 mg. Just shorten the antiplatelet effect to take on site. Next one, aspirin is also used to treat mucocutaneous lymph node syndrome. This disease, in the previous slide, I didn't mention this. Actually, this disease usually also requires a large dose of aspirin. This disease, we usually use MCLS to describe, because it is first described by a Japanese doctor, Kawasaki. So this disease is also named Kawasaki disease. Actually, it is one acute febrile eruptive disease in children. It is a syndrome of vasculitis. Now look at what is this disease. This disease occurs more in children, especially in boys. Mucocutaneous lymph node syndrome is a kind of systemic vasculitis. The patient usually has these symptoms: ocular membrane congestion, skin rash, and febrile. And in the mouth, usually has a diffuse congestion in oral mucosa and strawberry-like tongue. Hand and feet have heart edema. And the children also have non-purulent lymph node enlargement. The serious influence is the heart. And coronary artery dilation is common, even coronary aneurysm. Actually, this is the most serious complication caused by this disease. Try to avoid the Kawasaki disease developing into this serious result. So once it is diagnosed by Kawasaki disease, usually the drug therapy, it is very essential, including intravenous injection gamma globulin and large dose of aspirin and glucocorticoids. In this chapter, at the beginning, I mentioned this is one hormone released from adrenal glands. It also has very potent anti-inflammatory effects. When aspirin used in large dose, it can relieve fever. It also can induce anti-inflammatory effects. So in the treatment of this disease, large dose of aspirin is very important. It's very useful. And usually, this disease, the patient has fever. It's so common. Some antibiotic drugs are invalid. Actually, till now, the etiology of this Kawasaki disease still is unclear. But you should know today, in the treatment of this disease, the drug therapy, including these 3 agents, are very important. Okay, that's all for this section. These are the pharmacological effects and the therapeutic applications of aspirin. And especially low dose of aspirin in our daily life is so commonly used to prevent thrombosis formation, to prevent attack of some disease like angina pectoris. So what are the adverse effects of aspirin, especially when they used in a long term? So go to study next section.